Surgical intensive care in the United States began in the Department of Anesthesia at the Mass General Hospital. About 40 years ago, Dr. Henning Pontoppidan began the first intensive care unit for the critically ill. Today, that legacy goes forward, and we educate, we teach, we devise novel therapies, and we care for critically ill patients here at MGH.
The thing I like best about the ICU is the fact that you get to manage the entire patient. You get to come in the morning, evaluate what's happened overnight, make decisions, order tests, do the studies that you think are appropriate, act on those studies in the way that you feel is best for the patient. It's a lot of fun. I mean, you get to really run the whole show on very, very sick people, and you learn a tremendous amount.
The residents like their time in the thoracic anesthesia service because of the interesting cases as well as the procedures that they do. Each case usually has a thoracic epidural that the resident places, as well as a standard IV and an arterial line. In addition, many of the cases that we perform require invasive monitoring, such as pulmonary artery catheterization or a CVT line. When the residents get finished with this rotation, they are quite skillful in the placement of double lumen tubes. Also with the addition of fiber optic bronchoscopy.
The cardiac service here runs 4 operating rooms, has a separate cardiac anesthesia team. All the attendants there are very good teachers. Many have come through this program themselves, but others, like myself, have come from elsewhere. And so there's an enormous breadth of experience, but all have enormous enthusiasm for teaching residents at every level on the service.
Clinical fellowships are extremely important for anesthesiologists. In recent years, as the science of anesthesiology has become more and more complicated, the period in which we have to learn it has become shorter. Therefore, we offer top-notch fellowships in pediatric and cardiac anesthesiology, intensive care, and pain therapy. These are highly competitive fellowships, and they produce extraordinary clinical specialists.
There is life outside the hospital. The sailing experience here in Boston is unparalleled. They have very inexpensive sailing clubs that you can join and sail throughout the summer, both on the harbor and on the river. Running here in Boston is just a dream. You can either choose to run through the city, through the parks, or you can either choose to run on the Charles River, which is about approximately 15 miles of trails up and down the Charles River.
I was attracted by Boston, the city of Boston, and in terms of the size, that it was, I thought, very accessible to practice in terms of it's a big-sized city with kind of a small town attitude.
Well, actually, Boston's a great city to be in. There's a tremendous amount of stuff to do. It's an exciting, young city. It's clean. It's relatively safe. And the subway system is terrific. You don't need a car if you don't happen to have one. I'm ecstatic to be here. I think it's a great place.
We hope you have enjoyed this videotape about the Massachusetts General Hospital and its Department of Anesthesia and Critical Care. We look forward to meeting you and learning more about your interest in anesthesiology, and we would be delighted to show you our department.